Little Big Town and Better Man. Joining me now, Dr. Ryan Jennings, the Chief Medical Officer from HSHS St. Anthony Hospital here in Effingham. Good morning, Ryan.
Hey, good morning, Gail. How are you?
I'm doing great. How about yourself?
Never been finer. I got a sunburn on my head. I learned a really good lesson this weekend. Dr. Schmidt has always told me that expired sunscreen means it's expired. She's not kidding.
Yeah, she was telling you the truth, huh?
She was telling me the truth. You could really get burnt.
Oh my goodness. You know, I didn't realize even that sunscreen I hadn't thought about it, that it has an expiration date.
It has an expiration date. And, I look like a tomato right now, but that's all right.
Oh, I've only had like one sunburn in my life, and that was like 4 little strips each about an inch long and about a half an inch wide. And I'm so dark complected, I'd never burned. That was the only time, and I got that in Florida. And I whined like a 2-year-old. I know now why God made me dark complected.
Well, it's the cross we bear, but it was a small price to pay to finally get outside, truthfully. And although I didn't go out and do too much in the community, I sure took up the opportunity to get outdoors and enjoy the sunshine and the fresh air.
Oh, yeah, there were a lot of people that did that this weekend. It was, everybody had looked forward to it for quite a while. So.
No, they had. And, I think let's just hope. We're going to find out. We're going to find out. This weekend was a really great opportunity for us to see what happens when we do open up and get a much better idea of, how much this will spread when we do start to interact face-to-face. And, the businesses are excited, and I understand that. And I'm excited for them because I can't wait to go spend some money. But I also know that, we got to take it in steps and understand the consequences so that if it does, blow up, we're not completely vulnerable to the outcome. So thoughtful, mindful, I guess, is the word, mindful about how we do it, but still ready to get it done.
Exactly. So y'all are going ahead with elective procedures and everything now and still doing that safely, of course, but are you doing a little bit more all the time, Ryan?
We are, yes. You're exactly right. So, as you know, May 11th or 12th or whatever the day was, we did start doing some elective surgeries. Now we're moving forward with opening up kind of cath lab services and cardiac services, stress testing, echoes, those types of things. More and more, just outpatient services. And again, I think when you look across health systems across the country, that's what they're doing. They're taking it in measured steps so that the health care that you guys all count on is delivered safely. And different organizations have tackled it maybe a little bit differently, but on the whole, I think what you see is that it's done in stepwise fashion so that you don't just blow it up.
Right. And something that I wanted to point out, and I think that we talked about this at the very beginning of our interviews when we started several weeks ago, and that is that one of the main reasons that they wanted to shut down things and obviously was to, save lives and to keep people healthier. But a big point was not to overwhelm the healthcare system, right?
You're correct. And, we're fortunate. We've not had that as a major issue in downstate. I think that, the decision-making around how to reopen is just now starting to acknowledge the fact that maybe we're a little bit different, or at least downstate's a little different than northeast side of the state and in a lot of ways. And some of the rules are starting to acknowledge that. And so we're excited to do it, but that doesn't mean that you throw caution to the wind. You still need to be careful. We still need to be aware of those folks that are vulnerable. And certainly if you're a person who is vulnerable because of a health condition, you need to be careful.
Absolutely. And of course, it's going to be worse in the Chicago area up there because, and better down here because we are much less densely populated than they are up there.
Yeah, to me, it's a population density question in reality. I think where we've seen difficult times with this are highly dense population centers, and the further away from that you get, the easier it, or not easy, but the less severe the disease has been. And so let's just hope that as we reopen, we don't see a big surge. There have been some communities that did see it pick back up, and that's expected. I mean, I don't expect there to be no consequence of reopening. I think that we'll see an uptick in the number of cases, but will it be enough that it actually jeopardizes the ability to deliver health care, or is it just a handful of cases, and hopefully they all do well with their treatment, but not enough to overrun the systems that we have in place. So we're going to see. We're sure going to see over the next 10, 14 days, now that, if you think about the 14-day quarantine, the 14-day idea, over the next 2 weeks, we should have a good idea on the consequences of at least a limited reopening, and we'll take it from there. And I'm excited to do it. But, I think the folks being outdoors is huge. Keeping distancing is still a big deal. And, of course, again, if you're vulnerable or if you're going to visit someone who is, be respectful.
Absolutely, because that's the important thing right now. I like it. Continue with the precautions and be mindful. I think those are the watchwords right now.
I do too. We can do this. We just got to do it carefully, measuredly, so that if there's an unintended consequence, then we aren't in a situation where we've, thrown the doors off and suddenly have a mess to deal with. And so I think approaching a measured fashion is going to be what's going to make it successful. And I'm pretty confident we're doing that. And my hat's off just to the businesses that have been incredibly patient with this. And the community for being so thoughtful about how to make sure that we keep each other safe, because we are a community that respects each other, and we don't want to do something that would unnecessarily cause harm.
Absolutely. Well, Ryan, I think we've about covered everything, haven't we?
I think so. The other thing, and I keep trying to drop this in, is just, if you do have a serious health condition, do seek help. Unfortunately, we have seen a few folks that have delayed health care because of concern about possibility getting COVID. And, if you're having chest pain, if you're having stroke-like symptoms, those types of things, those are still emergencies.
Absolutely.
And you need to come in. And I unfortunately, we have seen a few circumstances where out of fear, folks didn't seek out health care.
Yeah. If you really are emergent, you need to get to the ER.
Absolutely.
Plain and simple.
And we've got a safe way to do it, and we'll every hospital has processes in place to keep people safe. And, that's what we're here for. So don't ignore the warning signs of serious illness, because I'm afraid that we are kind of seeing a consequence maybe that we didn't predict, because we've certainly seen less people use health care, not necessarily a bad thing, but we've also seen people make mistakes around not seeking it soon enough.
Something I hadn't thought of either. But, yeah, definitely a problem there.
Well, we keep learning.
Yeah, we do. At least, everybody's learned a whole lot from this situation. I can say that.
That, and I can agree with that. Just when I thought my wife had taught me everything I needed to know, and it turns out there's a couple things out there.
Yeah, isn't that the truth? Well, Ryan, thank you so much. Get some aloe for your head. And wear a hat next time.
No, that's good advice. See, yeah. I thought I was on the radio to give advice. Turns out you are.
I'm a mom. Have been for 43 years, so that's where that comes from.
There you go. Sometimes common sense prevails.
Yeah, absolutely. Ryan, thank you so much. We appreciate you. You can't even imagine how much.
No, thank you, and thank you for letting WCRC get us on.
Oh, absolutely. Take care, Ryan.
Bye-bye.
Bye-bye.
Bye-bye.